Hello friends and welcome to another episode of Better with me, Charlotte Wagerhall. I'm also known as Skinny Schedule and you can find me on YouTube, Facebook, Instagram, Twitter and all the social media platforms as Skinny Schedule. On today's show, this is an absolute must listen. We have GP and facial aesthetic guru, Dr Sharan. So Dr Sharan runs Peggy Day Aesthetics in Huddersfield. She also works with Skin Viva in Manchester. She's also qualified to teach others how to perform facial aesthetic procedures. In today's episode, you're going to learn the origins of Botox and fillers and what they actually do, how it can be used in the body, and which should be used to perform different procedures. But most importantly, what to look for if you decide to go ahead with any of these procedures. You don't have to be a medical licensed practitioner to run these. And that is so important that you do your research. This is an absolute must listen before deciding to go ahead with any of these procedures. Keep safe, do your research and listen to what's ahead. So I can't wait to get started and a big welcome to the show, Dr. Sharan. Sharan, I'm really pleased to have you here. A big welcome to the show.
Thank you.
I'm so excited about doing this podcast with you because there is just so much widespread information out there about sort of facial aesthetics and not necessarily the right information. So for me, my real sort of motive behind doing this was that I made the choice of having Botox earlier this year. Now don't look at me because it's all faded, so I need it doing.
No judgments here.
No judgment. Oh gosh, I bet you're looking at me like, oh, I can mark her up.
Not at all.
But yeah, my experience was really, so I wanted to make sure that I went to a reputable place. I'm 32, so I knew it was an okay age to do it. And I've got enough knowledge to know not to go to like your local sort of salon. You need to do some research. What really shocked me was how little there was out there. Yeah. There is about sort of what these procedures are, but not really anywhere where you can find out reputable places to go. A lot of the places I discovered were sort of like just Facebook and people leaving recommendations. And for me, that could just be anyone's friend that's doing it. Yeah. And the shocking thing about it is that you don't actually have to have a medical license to perform.
That's right. Yeah, you don't. It's not the law that you have to have any kind of qualification to be able to perform it.
Which is absolutely crazy with how widespread it is as well. Like every magazine, you can see adverts for it. I mean, gosh, there's adverts on Living Social and Groupon for it now. Magazines, it's everywhere, and sort of the Towie Geordie Shore effect, and there's horror stories as well. But also like mainstream places starting to sort of jump on the back with things like Superdrug.
Absolutely, yeah. Everybody wants a piece of the Botox action, don't they? I think, yeah.
It's just absolutely crazy. But what's so scary is like there's so much little information out there about what you should look out for, who should have it, why you should have it. And it's sometimes a lot of just companies that just want to sell to you and maybe not even reputable or licensed. Yeah. So I thought we'd maybe start with Botox because that's like the most common one. That's the one I had experience with. So with Botox, who should have it? What is it? What should you look for? Start from the top.
So Botox, essentially, the main reason we use it is we want to reduce lines, we want to reduce wrinkles. So technically speaking, as soon as you're an adult, you could have Botox. However, you may question, well, why would a 18, 20-year-old need it? Because they're not going to really have those lines to treat.
Yeah, this is what I always find straight. And just going back on that, touching on that. And so you have to be 18 to be able to have this, which is really young. And Botox, you said, is fine lines.
It is. This is when that's the age you can give your consent and say that, yes, I'm signing up to a procedure which is going to alter the way my muscles function, essentially. That's how we reduce the lines. But then what you need to be touching on your question of what should you be looking for in a practitioner, it should be somebody who's taking into consideration the person that sat down in front of them. They may have made a decision that, they want to treat these lines and wrinkles, but you really want to be seeing someone who's also got some ethics behind them in terms of, should I be treating this individual? Are they going to get some benefit? And that's a difficult one, really, because at the moment, there is no law, there's no regulation that says that this person can inject Botox, this other individual can't. isn't. It is a prescription-only medication, and this is where people get a bit confused.
Yeah, I was, because until we were just talking off camera then, saying about like what you had to have, and I didn't realise.
Yeah.
So you have to be able to get a prescription of the Botox serum.
So it's an injectable substance. So we inject it using a needle, and to do it the right way, the individual either should be able to prescribe themselves, which means they have a prescribing qualification. That means they're a doctor, they're a prescribing nurse, or they're a dentist who's also qualified and can write prescriptions. If you have someone that's not able to do prescribing themselves and they want to go ahead and inject Botox, they need to have with them, present at the time that the individual is seen, a prescriber. And again, a lot of this doesn't happen the correct way in the industry. You see people who have had someone write a prescription remotely, for example. They're not sat physically with them and the client, but they've written one later, and that is breaking rules. So if someone isn't a prescriber themselves, let's say they just work in the beauty industry, if they've got someone with them that's a nurse or a doctor and is writing the prescription, they're not actually breaking any laws there, because then they're seeing that client together, making that decision together, and then the other individual can go ahead and inject. This is a problem. This doesn't mean I agree with this. This is
that's crazy. So literally, like myself, I could open a salon, I could take you, not that you would agree to this, but I could take you along with me, sit with me, and then I literally could go out and perform Botox.
Yes.
So literally no training. Here's a needle, here's the Botox, off you go.
Now, yes, so you yourself, you could go ahead and do it.
Yep.
However, a doctor, a dentist, or a nurse, we are regulated by our own regulatory bodies.
Yep.
So our rules are different. So we do have to go out and get those qualifications and then say, yes, we're safe to inject, because all our regulatory bodies tell us that we must do no harm to patients. We have to work in their interest. So there is two standards here out there, and it's because the government haven't made any regulations around it. So essentially, a layperson with no medical background wouldn't be breaking any rules if they were sat with a prescriber, but a doctor who decided to do it without any qualifications would be breaking their fundamental regulatory rules. So
that to me
double
is
standards,
shocking,
isn't it?
Yeah, given that, like, just how, to only be 18 and
that's
be,
it.
I guess that's quite a vulnerable age. I mean, I don't know enough about it, I guess, yet, but, an 18-year-old, from what you said there, really doesn't need Botox.
No.
The fact that they then wouldn't maybe have
Unless you've got someone who's been like super expressive all their lives. I mean, occasionally you do see the young 20-year-old who has given themselves lines along the forehead because, I know for myself, my party trick used to be to wave my eyebrows as a kid. So you kind of create lines of it earlier because you've been extra expressive. So that's why I don't really assign ages to people, but it is a clinical decision I help them make based on what their skin's showing me. So you shouldn't really just say because somebody is this age, it's wrong, or somebody is this age, it's right. You've got to base it on what you're seeing sitting in front of you, because we're all so unique and we all develop lines at different ages. And for a young 20-year-old who feels they're looking 10 years older because they've already developed those lines because they're super expressive, I can understand why they might want it then.
I think it's more the worry of that they wouldn't necessarily, we take risks more when we're younger.
Absolutely.
So it's not so much that they shouldn't have it, because I guess it is personal choice. It's more, would they be able to find the correct information to take them somewhere safe?
And it's so difficult, isn't it? It's really difficult. We're bombarded with like before and after images, Instagram looking so glossy and beautiful. And this is a message that gets driven out there rather than what should I be thinking about before signing up to a procedure, what are the risks going to be, how long is it going to, all
That's
of the
so
things
true.
that we should
you
be
just
taking
see the
into
end
account.
This is it done. This is it. It's fine. It's probably with Photoshop, probably with a lot of makeup and a lot of filters.
Yeah.
And you only have to look at the Kardashians and the Photoshop errors, that go on there.
That's it.
And that's what scares me, and that's why it was so good to do this and sort of put it out there. So who should consider Botox, I guess? I guess
the advice I would give is if you've got to a stage where you're looking in the mirror and you're seeing fine lines and wrinkles and you're not happy about them, because obviously we're all going to have them. It's a normal process of aging. But if you're feeling personally not happy about them and you want to do something about it, then fair enough, you're the right individual. So you're an adult, you're not liking them, and then you go and find somebody who's reputable. And what I mean by that is, in my personal opinion, it should be somebody who can write prescriptions themselves rather than working alongside somebody that doesn't. And that is because those individuals are regulated, which means at their core, their very core, they mean you no harm. They want to do what's right for you. And their work is going to be grounded in that. So every decision they make with you will be based on your best interests. That means they're going to talk you through absolutely everything, how Botox works, what the potential side effects and risks are, how long you're going to get from it.
So how long does it work? Just going back then, so what is it? What are the side effects? Like you were saying, then covering it.
It's a purified protein. It's made by a bacteria. And it actually, when you look at it, looks invisible in a bottle. So we add sterile salty water to it so that it can be given to you in a form that can be injected into the muscles. So I have a little analogy, which I tend to give to most of my clients to try and explain how it works. So if you imagine it's like a road running from your brain, and that road is running to your, let's say your frown muscle, for example. When we inject Botox, we are essentially breaking a bridge that was along that road. So the brain is still saying, driving its car down that road, trying to get to the frown muscle to say frown, but because the bridge is broken, the car can't get over. So essentially, we've broken a link in the messaging. That's what Botox is doing. And if we've broken a link in the messaging, that frown muscle doesn't get that message to frown, so the muscle doesn't move. And if the muscle doesn't move, it doesn't buckle the skin. Right. Because it's when we constantly buckle the skin that we create the lines. So Botox itself doesn't physically do anything to the skin. It just stills the muscle that was buckling the skin, causing the lines.
It's a really good explanation. That's the clearest one I've heard.
Helps. Yeah. Good. And in terms of how long it takes for that process to happen, when you inject the Botox, it's going to gradually break that bridge. So if you think of like an army of men breaking a bridge, by about day 4, day 5, you start noticing bits of the bridge are getting weaker. So the movement's reducing because only dribs and drabs are getting across the bridge. By 2 weeks, that bridge should be fully broken. So that's when you notice stillness in a muscle, which is why we would never also recommend a review. So I do recommend clients get reviews after their treatment at about the 2-week mark, because that's when I would expect that bridge has entirely been broken and the muscle should be still. And that's when you'll start getting your best result. If at the 2-week mark, people still have little bits of movement, they have the option then to have a little bit more added, you see, because it means we've not fully taken that bridge out. And in terms of how long it lasts, that's really individual again. It tends to be how long does it take your body to rebuild that connection, rebuild that bridge so that car can get its message across from that brain right across to the frown muscle. And for the average individual, that's 3 to 4 months. So you wouldn't expect to go from no movement back to full return of movement. What you normally expect is little bits of movement creeping back in until you're back to your normal range. And that's a beautiful thing about Botox, actually, is that it does fully, entirely reverse and go back to normal. So if you tried something and it really wasn't for you, even if you had a side effect and it wasn't for you, nobody wants a side effect.
No one. But it's a risk that you take, isn't it? It's the risk that you take.
But it would always go back to normal. That's
which is really good, isn't it? And it fades out, doesn't it? Like mine's definitely fading out dramatically now, unfortunately. So if you went, if I went, I don't know, say every 4 months or so and it was ready, would they eventually sort of come back a little bit softer each time? Because sometimes you hear of people that used to have it and now lines just don't seem to come back.
Yeah, we're also breaking a habit, because if we're stopping ourselves frowning because we can't frown, you do find when it wears off, you've almost broken that habit a little bit as well.
Yeah,
so
that makes
also
sense.
That gives people a little bit of extra duration before they actually need to go and have it done again. You do find with most clients, once they've had it, they love the results so much that they don't want to see entire full movement return before they have it done again. So they never see those lines get to that sort of depth that they were to start with. Obviously, if you decide to have it a one-off and then go back to not having it, it'll just return back to how it used to be.
Which is good, I guess, if you decide that it's not for you, because it's not for everyone, is it?
Yeah.
Because
and there are times when you shouldn't have it, pregnancy, breastfeeding. I think sometimes people don't realise. And
that seems logical, but I guess it's not for everyone, is it?
Yeah. And a lot of the people seeking those treatments are childbearing ages, so it's something to make sure that you're checking as well. There's that your practitioner's asking you those questions.
That's a really good point, actually. I've never even considered that. So what can be? So now we know a little bit about what it is, how it works. what can be some of the side effects? Because even with the best intentions, the best clinic, things don't always go right.
I've done thousands of injections and I still mention all the side effects at every appointment.
Just in case.
And it's because you cannot say to somebody they're not going to have a side effect. You can say the risks are low and how you're going to minimize them, but you can't stop them.
100% guarantee, which I think is really important for people to know that are watching.
Absolutely. So those, the risks, if we break it down into like the common ones and then the uncommon ones, common side effects come from the needle because it's a needle being put into the skin. It does nip a little bit, it bleeds a little bit, and you do get what looks a bit like an insect bite type of swelling everywhere the needle is placed for about half an hour. That's very, very common. I remember one client once said to me, "Oh, I look like a Klingon." I said, "It'll only be like that for half an hour," and it does. It settles very fast. Anywhere that bleeds, obviously, there's a small chance of bruising as well. So they're the temporary side effects. The uncommon ones then come down to which part of the face has been injected. So, for example, around the eye area, if you're wanting to reduce the crow's feet lines, we have the tear gland that sits below the eyebrow. And if Botox was to travel towards that, you might notice a dry eye symptom.
Right, okay.
So that individual might have to use like artificial teardrops, for example, until the Botox wore off that. It would wear off, as I say. The other, and this is very uncommon, I've not seen a side effect like this, is double vision. Again, if you inject too close to the eye, it could affect one of the muscles that allows you to look outwards, which would be a horrendous side effect to have.
Would be,
yes. As I say, unfortunately, I don't think I've ever come across anyone that's had that, but it should be something that your practitioner discusses with you. With frown and forehead, uncommon side effects, I should say, are feeling heavy in the brow area. It's not something we would set out to do intentionally, but some of us really rely on our muscles working to express ourselves, and actually with Botox, it's a bit like walking a tightrope when we do treatment sometimes. A little bit too much, taking away a little bit too much muscle activity, the brow can lower itself, and that can make us feel heavy or tired. Not enough, we have too much movement remaining, and then we're needing more. So it is a fine balancing act. And then again, another one I think that people really worry about is eyelids drooping. Now, in the country, they say that risk is 1 in 100, which I think is really, really quite high.
That is, isn't it? I wouldn't have thought it would be that high.
I've not had a case of that ever, but again, it's not something I wouldn't stop talking about. I would warn people. But it's again a risk that can be lowered if you know the anatomy of the muscles and where the muscles lie. So sometimes if injections are done too deeply around the frown area, it misses the frown muscle altogether and tracks down towards the eye. And
so is there anything that you could do if someone, do they get it quite quickly? So would you get it whilst you're in the clinic?
Yeah, these side effects would all make themselves apparent in the first 2 weeks whilst those bridges are being broken, basically. So if they haven't happened in that duration, they're not going to happen later. I think that's good to know as well, because if you've hit that 2 week mark and you've not had a problem, you don't need to carry on worrying that, am I going to have this side effect? So it's not apparent immediately. It would be within that 2 week interval somewhere. And the problem is when you hit a side effect like this, you can't simply take the Botox out.
I was going to say that because I know of other, which we'll come back to, like sort of fillers you can dissolve, can't you? But you can't. So Botox, so if you get a droopy eye, you have a droopy eye until it fades. Oh no!
Yes. There is an eye drop we give to temporarily help elevate the muscles a little bit, but it's not ideal. It's not going to take you back to your baseline. But that's the thing. Then it's a case of waiting it out for that side effect to wear off, for those bridges to be rebuilt, which potentially could be 3 months or so.
Yeah, 1 in 100. Really high odds for how common a procedure it is. I've never seen it.
I think that is because of how many people are injecting in the country, and as I say, not understanding the anatomy. I think if more people were better trained and understood where the muscles lie and what depth the needle should be at, because it's not the same everywhere on the face, that risk would be a lot lower.
And that's why it's so good to chat with you, because you actually teach other people how to do these procedures. So you are like a bit of a guru. So what should someone look for? I've never been called a guru before. A guru, yeah. The facial guru.
Thank you,
well, look at your face. It looks incredible.
Oh, thank you.
So what should people look for then? So if they were like listening to this and they're like, actually, I've made the decision. I do want to go ahead with something like that. What should they look for?
Look for someone that can prescribe is my main take-home message. Okay. So be
How
that
would
a
you
doctor,
find that out?
a dentist or a nurse. You want to know that they're of those backgrounds really. And ask to see their qualifications. I certainly don't mind somebody asking to see my certificates. I will get them out quite happily, because I think that's someone that's like taking consideration over the risks really. And I think any practitioner who has those qualifications wouldn't mind you asking. You can check people's, like with doctors, you can check their GMC number, make sure they're registered. So you can ask them for that number and look online yourself as well. So you can just double check that those individuals are who they say they are. Make sure they have cosmetic insurance. All of us should be working with insurance so that if should a problem arise, we have some kind of cover as well. And then also look at their level of training, because training out there really varies. And it's one of those things where you can go on a day course and you can become qualified in being able to do the basic treatments. I would say it's a bit like driving a car. When you pass your driving test, you're not a great driver. You're a safe driver. That's what it's about. We're safe. We get good once we've had practice and we've done lots of procedures.
It's a really good way to describe it, isn't it? And that's what you want, isn't it?
Absolutely.
Especially because Botox tends to be on the face, doesn't it? Like, I don't want someone who's just say, like, I want someone who's good at it as well as that. And that's why it surprises me how, I mean, I guess it's because it's so widespread and everywhere now, but like how many people go to the dentist and then come out of Botox?
Yeah.
And I don't know, I'm sort of much of a believer that we can be a bit of jack of all trades, but only sort of master one or two. And I think you need maybe a bit of a skill at doing it.
Yeah, I would agree with that, because I think if you only do something every now and then, you might be brilliant at your everyday job, but that thing that you only do every now and then, it kind of becomes a bit like a hobby, doesn't it?
Yeah.
That doesn't necessarily mean you're going to be great at it. However, I know some great dentists. I work alongside some great dentists.
This isn't criticising anyone. It's just, it's just surprising.
But they do lots and lots of it. So it could be their main occupation. I would say just ask about their number of procedures they've done. And everybody has to start somewhere. So, you may be meeting somebody who's in their early days and going to go on to be brilliant. And they may already be great. But if you're particularly cautious, just ask about how many procedures they've done, if they've encountered any problems, how they've managed those problems. And it's absolutely fine to ask those questions as well.
And it should be, like, obviously there's some, like, it should be a fresh needle out of the packet. You should see them taking it out of the packet.
It should all be sterile.
And it should be a vial that's not been opened.
Yeah, so with Botox, it works in different ways. So if you're seeing someone who... It's a bit of a technical one, actually, Charlotte. So if you're in a clinic and working in a busy clinic, it's absolutely legal for the practitioners that are there to what's called stock hold Botox. And as long as they're using clean needles, they can work from a large vial.
I was going to ask that. So, they can literally take some out and then...
But the key is it's not shared needles. It's all clean. If, however, the person seeing you is writing a prescription for you for Botox and ordering a vial on a prescription rather than on stock, that means that Botox belongs solely to you, and then that one shouldn't be shared amongst individuals. It's a hard one for clients to pick this out, really, as in, are they doing the right thing? Are they not doing the right thing? But by all means, just ask the question.
Yeah, I think that's really important to know that, isn't it? Because that's something that you wouldn't know. And they should always wear gloves. Should they do anything to your face before?
Wipes, make sure all makeup is removed and the skin is as clean as it possibly can be, so we're lowering the risk of infection.
Good.
And you should be given some aftercare advice as well. It's really important after Botox for a couple of hours to keep upright, and that's so that you don't lie down or accidentally press on the areas that have been injected and push it to the muscles we don't want it to go towards. I also tend to recommend to all my clients not to wear any makeup for 6 hours after procedure on those areas that we've put the needle through, because again, you don't want to cover it and cause an infection.
Infection.
Yeah. And then for a couple of days, you also want to avoid things like alcohol and things that make you hot, so no exercise. Baths and showers are allowed on the cooler side, not too steamy. And the reason for the no alcohol, not getting too warm and not exercising is so that you have a better result, because when you get really warm and you drink alcohol, it opens the blood vessels in the face, and opening them up means that there's less of the Botox in that area to break those bridges, so it doesn't work as well.
Wow.
Which puts a big question mark over all the Botox parties you see out there as well, because often a lot of those are alcohol fueled, aren't they?
Yeah, I mean, I've not done it myself. I think I know other people that have had, they call that, they have someone come around, and I'm not sure I'd feel
so
comfortable with
one,
that
your decision making's impaired, isn't it? If you've got a bit of alcohol on board, you may not make the same decisions you would have made if you didn't. And then secondly, it's not recommended anyway, because you're not going to get a nice outcome.
So how many days should you sort of avoid? Because I think when I had mine, I just sort of stayed in. I sat upright.
Oh, bless you.
I know I didn't like sauna steam. I'd do that quite a lot, and I didn't exercise. So I was a very good patient, because I was worried. I didn't want anything. I sort of went into hibernation for a few days. How how long sort of should you wait for? Because
48 hours.
48 hours, and then you're good to go. You're okay, and then that's pretty much it, sort of aftercare wise, isn't it?
Life can resume as normal after that. Yes,
just with a smooth face. So you tend to have Botox in the face, but also you can have Botox into the armpits to avoid sweating.
It's an amazing treatment under the arms. Yes, it can be like really life changing for individuals who are affected by excess sweating. So men, women, I've seen them say that it's the best result they get, really, because they've gone from having to change their clothes a few times a day to feeling really self-conscious or wearing layers to hide sweat patches to suddenly just being free to wear whatever they want and not giving a care to the world.
Is that painful under there? It feels like
it's not really.
Is it right into the?
It's very much just in the skin surface, which is where the sweat glands live. Most people barely feel it. You can put numbing cream on as well if someone's particularly sensitive to a needle. But to be honest, even without it, it's not a painful treatment to have. Works very well. And actually in the underarm area, it tends to last for about 6 months as well.
Oh, longer. Yeah. Wow. It's really interesting, isn't it? Because, I mean, like for a couple of years ago, Adam's dad, my husband's dad, he's had a couple of strokes, and I did some research into things to make because his arm's sort of quite like locked and he can't move it. And he actually receives Botox in the NHS, which I sort of researched because it relaxes the muscles so it feels less tense.
Yes.
So it can be really
it's actually been
amazing.
Around for decades. Yeah, especially when we look at all the medicinal purposes, they put it into the bladder quite commonly for people who have an irritable bladder and feel like they have to go to the toilet all the time. So it's got uses all over the shop.
Wow. Yeah, I never even knew that one. Anywhere else that you'd have Botox?
Well, pretty much anywhere and everywhere. So cerebral palsy again, where people
some of my students have had Botox. They'd come in sort of joking, like, I've had Botox, miss.
Yes. So again, if the muscles are in spasm, it's really, really useful there. I think a nice thing for you to know might be I can't remember if it was a husband that was the dermatologist or the other way, but anyway, there was a couple. One was a dermatologist and the other worked with the eyes, so in the ophthalmology department, and was dealing with squints. So people who get squints and their eyeball pulls off to one side had injected Botox to try and treat the squint, and that's how they noticed the lines around the eyes soften. So that was its first way it was introduced into the cosmetic industry, was by a husband and wife team, one who was treating the squint and the other noticing that everybody was getting less lines around their eyes. So and that was basically the introduction into aesthetics. But prior to that, it was always
and then it's just sort of gone on speed since then, because I think it was more the noughties where all the frozen faces started appearing. And now I think it's hopefully coming out the other side of that. And what's taken its place, which is sort of our next one, fillers.
Yes, fillers.
So obviously you can have, I just learned recently, so with Botox you have to have a prescription or someone to prescribe to be able to get hold of that. With fillers, which I only read recently, you don't have to have any. I literally could order it online and set up shop and start doing fillers. And it was an article talking about sort of like the Geordie Shore cast or something that have had all these procedures and too much, and people just offer them free, and actually they don't have to have any training.
It's frightening, isn't it?
But also those horror stories of lips like exploding, pus coming out. What is going on with? So what are fillers?
So fillers, they look like a gel, and they're made of a substance called hyaluronic acid. Essentially, it's just a sugar molecule. The acid term, I think, makes people worry it's corrosive. It's not at all. It's just a name they've given it. And we already have that in our own skin. So when it's injected, it integrates with your own collagen. However, if it was absolutely identical to your own skin, then you'd break it down within a day or so. It'd be gone. So they cross-link it with other molecules to stabilize it. So that's essentially what it is. It's a gel, and we use it to sculpt with. So it's like artistry, if you like. If someone wants like a cheek lift, for example, an enhancement, just the way an artist would clay model and sculpt a face, you can use it to sculpt a face and create shape where you want to create shape. Where people have got lines that aren't going to respond to Botox. So, for example, you don't really like to use Botox too much in certain lines in the lower part of the face, because there the muscles need to function.
So we're talking more sort of like your smile line? Is that more like you meant to have more fillers?
That's it. Better with fillers, because obviously if you start paralyzing the muscles in that area, you're not going to be able to speak and
That's
talk.
a really good point. Yeah.
So So all the Botox may have helped to some degree. You're more filler based there. So again, it's using as a shaping tool. It's injected into the skin, and when it's injected in, that's when the risks can occur with the horrible, scary pictures that we see, because obviously there's the needle side effects, just like Botox. So you can get a bit of nippy pain, bleeding, swelling, bruising. They're common things. But then you've got to think about all the other things that lie under the skin as well. You know, you've got your nerves, your muscles, blood vessels, and it's knowing about what the needle potentially might do to those as well. I don't know if you want me to go into some of the sort of more uncommon side effects.
I think it's important to know, because if you make that decision, you don't 100% know that you won't have that. Like the hopes are that you won't. But
This is it. I think everybody goes in with the blind hope that I'll be fine. And I'll come out with this amazing, like whatever, pout or these beautiful cheeks. But we've got to know what else could go wrong. So the main thing I drill home to all my clients is that there is a 1 in 15,000 chance of blocking a blood vessel. So that might not sound like a lot, but if it happens to you, you're going to be really upset about it. And that can happen with any practitioner, even someone that knows exactly what they're doing. But again, there's ways of minimizing risk. And first, I should explain what happens then if you block a blood vessel. So if you block a blood vessel, the blood isn't going to flow through that vessel to the skin like it once would have done, which means an area of skin is going to be deprived of its blood flow. If you deprive an area of skin of its blood flow and you leave it like that for too long, eventually that skin will say, well, I'm going to die because I'm not getting the nutrition I need, I'm not getting the blood I need, and the skin will start to break down into like what looks like an ulcer initially, and then it will become more horrible, if you like, and it will eventually heal, but it may leave a scar in the area as well.
And is that why, when you see, because I think you see it quite a lot on lips, is that what happens with lips when they're sort of pussing and people can... So
pussing may just be infection, but obviously an area that's deprived of blood flow is more likely to get infected as well. So it could be that's happening as well. Yeah. So the key is, if a blood vessel blocks, you get telltale signs. And this is where, again, you need someone who knows what to look for. Your clinician, your practitioner should know what to look for to say this blood flow is not normal. So if you get an area of paleness or greyness, which really hurts after treatment, it could be that the blood's not reaching part of the skin and that there's a blockage somewhere. So all clients should be told to look for this in the first 24 hours.
Wow.
Usually, if you block a vessel, you can see at the time of treatment that something's not quite right, but it will usually make itself known in the first 24 hours. And then if that client was to contact their practitioner, the practitioner in that situation should be arranging to see them ASAP that day. And then they should be checking the blood flow in the area. Quite happy to show you. So what you would do to check blood flow is you squash the area. So if I squash my fingertip, you milk all the blood out of it. When you release, the blood flows back in nice and quickly. An area that's deprived, it won't flow in at all, or it'll flow in very slowly. And in that scenario, we need to be getting on with dissolving the filler so that we can undo the blockage. If you undo the blockage, the blood will flow normally to the skin again, and then the skin will be fine. But if you don't deal with it soon enough, or you leave it too long, that's when that skin comes to detriment, and that's called necrosis. When it does come to detriment.
I've seen that in all the magazines.
Yes. Yeah.
Oh gosh, it looks
1 in
horrible.
15,000 chance. And you need to know how to basically dissolve filler. So the clinician you're seeing should know how to dissolve it, how to recognize it, so they can help you with that scenario.
So if you were having filler and it's sort of, you were like, oh, I'm not quite happy with the result of that, can they dissolve it then and there to change the look? How long does it take to dissolve?
So dissolving filler, when you put it in, it starts to dissolve pretty much straight away, but most of it tends to happen overnight. So if you don't see an impact straight away, it's not to worry. It can work overnight. And dissolving agent, once injected, can actually carry on dissolving filler for up to 2 weeks.
Okay.
So if someone was then going to later on have another treatment, you would always say wait at least 2 weeks after dissolving, because you want to make sure it's not going to take away any of the new product. The question you asked there about if they don't like it, can you dissolve it straight away? You've got to remember, initially with treatments, there's going to be some swelling. So they may not be seeing their final result. So I would suggest that the practitioner advises that you try and allow the swelling to settle.
And then see what it really looks like.
And see what your result is going to really be like. Yes, absolutely. Minus the swelling before you make a decision to dissolve.
And is if lip filler the same as filler that you'd use in the rest of your face? Because that seems to be, I think fillers seem to be becoming big because there's this like lot of bloated faces that are coming out. But before that, the bigger thing is the lips and the huge dock pouts that are out.
The trend that's going towards that is
I mean, Kylie Jenner really, I think, was the the lead person that I
was.
think drove so much interest. And for years, she said it was just lip liner and clever tricks. And then she came out as having that. But I believe that she's had it dissolved now.
I think she's had it partly dissolved looking at her lips. They haven't quite returned back to their baseline, but it's a much nicer lip enhancement that she has now. It looks much more natural. And I've got to thank her because, you know, it's encouraged other people to come and get their very, very full pouts dissolved and then go for a more natural look, which I think is only a good thing.
Yeah, because it's, I mean, some of them, I mean, you're just walking along the street and it's like a, you know, it's not.
No, it doesn't look natural.
Yeah,
doesn't
it
flow.
doesn't.
And,
so is there any sort of laws on, I'm not sure laws is the right word, on, because obviously you're there to perform no harm.
Yeah.
But I guess part of aesthetics is, I guess, everyone's a little bit different and personal choice. So some
Absolutely.
people see these huge pouts on things like Towie and sorts, and they want that very fake lip look.
Indeed.
Is there like a limit on how much someone can put in? Like a legal cap?
There's no limit.
So you literally could go as big as you
could,
want.
Yeah, I think it comes down to the comfort of what that individual wants and also how comfortable the person injecting them feels about it as well. I mean, I could sit with my colleagues and we will all have a different threshold as to how comfortable we are to take someone further, because we all have our own take on what looks nice, and that's subjective, isn't it?
Yeah.
And I think from an injector's perspective, we have to be comfortable with what we're doing as well. So for me, I'm very much about the more natural look. I don't mind going a tad on fashion, but I have a low limit for that, and I just don't draw those type of clients because they don't see those before and afters from me.
Yes, I guess, you'll draw a different client.
Yes,
so what are people asking for a moment? Or what are the common things? So obviously, are you still getting asking for the Kylie Jenner style lip?
You do get people saying, can I have a really, really full lip? I just want to have more volume. But I've got to say, they say it with a, but I want it to look natural. And I think that's quite nice to hear now. So I am getting people saying, I want a full lip, but I want it to look natural. I think what people mean by that is they don't want the shape to distort. They want the volume, but they still want to have a nice normal contour to the lip. They don't want it duck ledging out.
That's it. And because it goes down, doesn't it? Shrink. It just starts dissolving eventually. It fades out. It doesn't quite go back to its.
So all filler will eventually break down gradually. Depending on the product, it may be 6 months or it may be 12 to 18 months if you've gone for one of the more premium fillers, the nicer, longer lasting ones. But it will always break down and go away to nothing.
So why do people get lumps?
So lumps could be a number of things. When the filler is injected, if a little bit of it has been injected in a clump, that could be a cause of a lump. Basically, the filler has just gathered itself in a little ball. In the initial stages, sometimes practitioners can blend those out very easily if you present early enough. Or in the first couple of weeks, if someone notices a lump, it could be swelling and bruising, which is going to go down anyway. So I think if ever you've got a lump after treatment, it's important to go see the practitioner and just get them to diagnose, is this filler? Does it need blending out or does it need dissolving because we can't blend it out? Or is it just swelling and bruising and it'll go on its own?
And would someone be expected, I'm going off track here a little bit.
Fine,
I'm just thinking, so if someone went and had the filler and they think, oh, I've got a bit of a lump, would they be expected to pay to be seen if they've got a concern?
I think every clinician will work differently. Most of us don't charge for ongoing care at all because I think that's part and parcel of what you've paid for when you've paid for that treatment. I think most reputable clinics and practitioners will work that way, that they will look after you. I was interested in that,
if it was more a concern rather than I want to top up, if you're like, I'm a bit worried, can I come in? They should accommodate you with that.
Absolutely. I think it's nice practice. But again, everybody will be quite individual, I imagine, with that
and
as well.
And is there sort of like ballpark figures for any of these sort of treatments that we've talked about?
Yeah.
Because I guess how do you know whether what you're getting, that's too good to be true? You know, if someone's charging really low, it's like, wow, you should, that.
Absolutely.
How on earth have they got it for that price? And also, on the other end of the spectrum, people have had 2 injections and it's £500. You know, what's the sort of, is there any?
There's a huge range out there, and it's partly to do with the fact that there's quite a huge variety of fillers out there as well. There's a lot cheaper brands and then there's more expensive brands. So if your practitioner is working with the more reputable brands that have come from reputable sources, and I'll touch on this as well, then they're not going to be able to get hold of those fillers at a low price.
Right, okay.
So then there's no such thing as a cheap deal is a good deal because if they've got the product from the right places and it's trackable where it's come from, then it will have come at quite a cost to the practitioner themselves.
And does that work for Botox as well?
And that goes for Botox as well,
so
yes,
there's like
absolutely.
different sort of
There's different
qualities.
There is, yeah, there is. And in terms of the sourcing, so there's certain aesthetic pharmacies who, when people manufacture, the people who manufacture fillers, for example, they will say, yes, I'm happy with this pharmacy and this pharmacy supplying it when asked for. And then there's other places that have popped up, and the manufacturers who have made the fillers can't guarantee where they've got that product from. So is it the same product? Is it a mimic product? Or do we know what's being put in? And those other companies that are providing these same products or so-called same products for less cost won't have the same cover or insurance. So should something go wrong and then your clinician need to speak to the manufacturers, they won't get that support from them. So do be wary of people offering it far too cheaply. So, I mean, I would say generally, I use mostly the Juvederm range of fillers, and most people out there will be charging a good couple of $100 for the product, up to potentially $400 for a syringe of product as well, because again, within that range you've got the short acting and the long acting, which have their own prices. I would be very shocked if someone was charging a lot less than that.
Gosh, it's interesting. How would you know as well if your clinician is using like a premium brand? Or
Again, it's just being bold enough to ask that question. Which brand are you using? There's a good few reputable brands out there: Bellatero, Restylane, Juvederm. They're all great fillers. There are more and more coming to the market all the time. And the hard thing is with the newer products, they may be equally reputable, but we just don't know a lot about them. Yes. So I would say at the moment, maybe stick with the names you know, and then also ask where they're sourcing them from.
Got you. And would that be all right? Would you be able to sort of get that on Google as someone who's got no sort of idea on like what a good brand of like filler or Botox is?
Yes.
Would you literally be able to Google the brand and check whether that's a premium brand or not?
I don't know if they put that information on their website actually, in terms of, yes, these are the places that we are happy for them. But if you were asking the clinician the question of, do you use aesthetic pharmacies and which pharmacies do you use to get the product from, and can it be tracked and sourced? Those would be the questions to ask really.
Right, okay.
It's an absolute minefield when you think about it from a client's perspective.
Is, yeah.
The number of things that you have to think about really.
The more you're talking, the more I'm like, oh my goodness, it's just...
Yeah, because obviously I work in it. It's easy for me to sort of think, oh yes, I know that pharmacy, that's the one I want to avoid. I don't want to obviously do any name dropping or anything like that really.
Yes, yeah.
But I just think, yes, from your perspective as someone who doesn't work in that industry, it's got to be really difficult.
Yeah, because you could just say to me, yes, I use Coca-Cola. It's the best.
Absolutely.
I've got no idea. You know, if Coca-Cola had a filler company, I've got no idea whether that's better than another one.
And if it's said with enough confidence, you really just believe
and
people,
you've got the
we?
certificates and a clean clinic. I mean, because there's some of the basics you should look for. So going back to my original question, sorry, a little bit. I just thought I wanted to get that in there while we were looking. What are the other things that people have in? So lip fillers seem to be a really big thing.
Lip fillers are very popular. Cheek enhancements are becoming more popular because people love that contoured look at the moment. We see it with makeup, don't we, with the contouring. And those that have cottoned on have realised that, I could do this with filler as well.
So what do they actually... I never quite understand. I've got quite big cheeks. So what do people actually do?
So you can basically give yourself more of a defined look on the cheek. So you can put filler along the cheekbone itself just to give it that defined look like you would with blusher and bronzer. You can create that same effect. Jawlines have become very popular as well.
Yeah, I've seen a lot of that as well.
Yes, yeah. So that very angular, very defined jawline has become a bit of a fashion trend at the moment. I mean, the defined jawlines have been beautiful across the ages. If we go right back to like the Egyptian ages, we talk about Nefertiti, and we still use that word in aesthetics when we talk about the neck and the jawline, about the Nefertiti lift. And because a nice defined jawline is always considered more youthful and more beautiful. But there is this slight edge on going a little bit masculine, I think, in some women at the moment, which again is personal, it's subjective, and it's what people would like the taste of. But even men are going more for jawline filler because obviously a nice strong jawline in a man looks more aesthetically pleasing. So I think that's been a big favourite at the moment for a lot of people for lots of different reasons.
Wow. And are you getting more and more men through?
Definitely, yes. It's. I think that's really nice, actually, to see men looking after themselves. I've heard a couple of them say, "Well, I do a lot for my body. I look after myself, keep myself fit. But one thing I can't do is really alter what's happening with my face."
Yeah.
You often find people that have lost a lot of weight, for example, as well. The weight really falls off their face very rapidly, and that's something you can't put the volume back on there very easily without gaining, and they don't want to. So I'll often see people coming after they've lost a lot of weight as well, in terms of what can I do now to just give my face a little bit of volume back to where it used to be, not because they're really looking to alter themselves too much, just to more go back to how they used to look and feel more
so
comfortable.
fillers are more for sort of volume, and Botox is more for fine lines and sort of softening.
Exactly.
Is that how you use the best?
Perfect.
Good. It's good to know that. And what sort of horror stories have you come across? Because I'm sure now that with how widespread it is and how unregulated it sort of really is, how many people are you getting through that you just, oh my goodness, what are some of the ones that you've come across that you've personally had to sort of correct?
There's one that's never left me. It was a young girl who had bought her filler online herself and had watched a few YouTube videos, and she had injected the filler into her nose.
So is that because that's quite a non-nose, what's it?
So it's called, non-surgical rhinoplasty. So using filler basically, and you can use it to disguise bumps in the nose, or you can use it to elevate the nose so that it has a taller stand. Now this young lady had an oriental nose, so the bridge of her nose was quite flat, and what she was hoping it would do would elevate it so that it had more height to the nose on profile. And I remember she presented about 36 hours after she'd done this treatment to herself, and the nose was extremely painful, very dusky grey, and just looked like it was losing its blood flow. So I think what had happened in that scenario was she'd accidentally got the filler into the blood vessel. That's right. I felt obliged to help her, and we did dissolve, and it was the worst thing I'd seen, because the nose tissue had already started to die a little, and that necrotic tissue was starting to come through the pores as I injected the dissolving agent, and it stayed with me. I just thought, oh my goodness. And luckily for her, she was fine. Her nose made a full recovery, but it was a really, really hard lesson for her in terms of what happened and what potentially could have happened. Like that nose
it just shows, doesn't it? And that's why I think it was so important to sort of put this together and give the people out there some tips of like what they should look for. And I could carry on talking with you for hours, because like it just fascinates me, and I'm learning so much. So where can people find you? So on socials and in clinics if they're interested in learning more.
So I'm from Huddersfield, and my business is called Peggy Day Aesthetics. So you can find me, or I have a Facebook page, and I have an Instagram page as well. So you can find me on there. I do have a basic website as well. I also work for a clinic in Manchester called Skin Viva. So if you're more in that neck of the woods, you can find me there too. I work most days. I still do a little bit of GPing as well, but it keeps me busy.
But this is just sort of your new passion, and it's something new, and I guess it's something new every day, isn't it?
I love it. Yes, I love it, because I'm getting to work with people every day. I'm getting to make a really positive difference. And it's really nice. It's nice to be part of people's journey. It's a privilege, really.
Well, thank you so much for coming on. And like I said, I could talk to you all day about all this, but thank you for possibly someone out there going to a reputable place and, potentially saving someone from going through blocking blood vessels or going somewhere unreputable. Do not inject yourself. Do your research, and don't be afraid to ask those questions that Sharon's gone through. You shouldn't be afraid to ask to see qualifications. You shouldn't be able to be afraid to ask about gloves and the vials. There's just so much to take in. Just do your research. Don't go to just your local sort of beauty salon without doing your research first. So that's all for now, guys. So thank you very, very much.
It's all right. It's been a pleasure. Thank you.